So what steps can you take when you go to see a plastic surgeon to make sure that you don't end up a revision patient, that you don't repeat the same mistakes that happened the first time? A lot of complications come from a patient just simply being oversized. There was a mismatch between the implant and their tissues. Resizing a patient sometimes takes a little rethinking to get over that need to be so big, because this is expensive and you don't want to keep doing it and doing it, so you have to change something. A lot of patients at the time of their first breast augmentation, perhaps their surgeon only offered saline implants, or perhaps that's all they could afford. So there are new options out there, both in fill. Implants can be filled with silicone, and shape. We have new alternatives that they may not have had 10, 15 years ago. A lot of women who had saline implants complain about visibility of the ripples and the wrinkling and a hard feeling. We now have different options to add some internal support. The internal supports that we're talking about are FDA approved, biological, sort of like a mesh or a scaffold. And what happens is you insert them, you give a little support at the bottom of the breast and sort of wrap it around the base of the breast where your tissues are just too thin or too weak to support the weight of an implant. And then over time, usually within the first year, these materials tend to just be integrated into your own body, replaced with your own tissues. And the wonderful thing is that, when we do mammograms and ultrasounds on these patients, these materials are basically gone at a year.